Good afternoon. I'm Jody Hanson, Director of Public Affairs and Communication for Johnson County Government. With me today is Dr. Sami Ariola. He is the Director of Johnson County Department of Health and Environment. We also have Allison here as our ASL interpreter. Thanks to both of you for being here. Dr. Ariola, I thought maybe we could start by talking about your vaccination plans this week.
Thank you, Jody, and good afternoon, everyone. This week, we're going to be running clinics at Okun Fieldhouse and at our new Lenexa location. Okun Fieldhouse would largely be devoted to second doses. So if you got your vaccines 3 weeks ago and we told you to come to the same location at the same time for your second dose, and it's due this week, we will be there. There are anywhere from 1,200 to 1,300, slightly over 1,300 doses each day that we're going to be giving out at the Okun location for second doses. On Tuesday, tomorrow, and Wednesday, we have first dose clinics at our Lenexa location. And each of those days, we have 1,800 appointments booked each day. And so for the week, we have over 8,000 vaccinations that we expect to conduct in our clinics. And on Saturday also, we have partnered with Heart to Heart to open up a vaccination appointment for our utility workers. And that plan could vaccinate anywhere from 600 to 1,000 persons on Saturday. And for those that qualify, we have reached out to them through Heart to Heart, and they're booking appointments on Saturday. Also, this Thursday, we do have the another transportation clinic at our SDOB building here in Olathe. This is where we are partnered with Josh Powers and the Transit Authority, and we bring people that need help with transportation to the clinic. Our staff will vaccinate them, and then we'll take them back to their homes. That's occurring also on Thursday. Also this week, we plan to vaccinate 50 homebound residents. So we've got teams that are going into homes. We have done, I believe, about 92 thus far. This week, the plan is to vaccinate 50 residents who need help. And my understanding is after Thursday's transportation clinic, we will have vaccinated everyone that has indicated that they need help with transportation. Now, we have continued to work with the area agency on aging on the program where they take meals to people at home. They have prepared cards and they've sent vaccination information to their clients. And so as we get more information and we identify more of our residents that need us to bring vaccines to them, our programs will continue to address this. And those are largely DHA clinics. However, please also understand that our partners are continuing to vaccinate. All of our health systems are vaccinating this week, and pharmacies are vaccinating. Of course, they're getting their vaccines directly from through the Federal Pharmacy Retail Program. So vaccination is continuing. We're also finalizing logistics to send vaccines to private providers, private doctors in the county. And a few of them have been approved by KDHE, and we're just working on the logistics of making the vaccines available to them as soon as the vaccines come in this week. These are really good efforts and different things that are ongoing, trying to ensure that we have different avenues to vaccinating our residents. This week, we are expecting the highest number of vaccines that we have gotten since the pandemic started. We will be getting about 18,720 doses of Pfizer and 1,000 doses of Moderna. That is expected this week. And typically we will get them Tuesday, Wednesday. And so as we get them, those are going to be split between us and our partners, and we again begin to vaccinate. And also tomorrow, we are going to be releasing information about what our plans are for next week. What I can tell you is there will be several thousand opportunities to get vaccinated. We do have quite a few people that are due their second doses next week. But in addition to those, we're working on finalizing plans to open up appointments for a few thousands of our residents to get vaccinated next week, including hours that we've not been able to do before. Afternoon hours, Saturday hours, all those things are being worked out, and I should be able to make some more specific announcements Wednesday.
Well, it sounds like a busy week. a lot of plans happening. So that's great news. And so I just wanted to reiterate one thing I heard you say. So we're expecting close to 20,000 first doses this week, but we don't have them yet. Those you said will come in. You said Tuesday or Wednesday, and that's typical.
That is typical. So we got notification of what to expect this week. We typically will get that Tuesday, Wednesday, and then it will come in. The first doses will come in Tuesday, Wednesday, and the second dose is what we call the boost will come in Thursday, Friday, or Wednesday, Thursday, depends. So we don't have them yet. However, that's not disrupting our clinic next week. As we've always done, we always hold on to enough to let us run the Tuesday clinic. And so obviously if we don't get more, then there's a challenge beyond Tuesday. There's no challenge for the second doses. We have the second doses, and I'm pretty sure that the first doses will be here. It's always been here, and that's the way that our clinics have run. Now this week, because we're getting a lot more, we've been working with our partners to increase their output, and several of them are taking more vaccines and vaccinating, just like we are also increasing our output to be able to vaccinate more people this week and next week.
We've gotten some questions about the various phases now that as of today, the state has opened up phase 5 and Johnson County has opened up phase 5. So are there appointments available for people who are in phase 5 or 4? And what kind of prioritization is happening between maybe people in the earlier phases who haven't gotten their vaccination yet versus people that just became eligible today?
Yeah, excellent question. Again, we moved to phases 3 and 4 a week ago today, based on Governor Kelly's announcement. But she also announced on Friday that if you're in phase 5, you qualify. So to go back to what I've consistently said, the phases are important only because we did not have enough vaccine, and the need to prioritize was important so that we can be clear about who we are targeting when we had fewer doses. And so moving to phase 5 basically means one thing to me. It means that if you are a Johnson County resident and you are 16 plus, you do qualify. That's the good news. The not so good one is now we have a lot more people that qualify for the still not enough vaccine that we're getting. But again, we do have to balance what we're getting with our capacity to distribute them quickly also. So 20,000 vaccine in a week is a lot better than when we were getting 1,200 or 4,000 or 8,100. So we're happy about that. Now, the question is, do we prioritize? There are groups that we are still prioritizing. We still want to finish the 65 plus. Last week, we shared, based on the data that we received, that we vaccinated more than 75% of that group. So I know that we vaccinated more than 75%, more because we don't have data for those that are vaccinated outside of Kansas, and those data were at least it's a week old. It's more than a week old right now. So we do know, and so that number is higher than that. We know that, and so we have a list from 2 weeks ago when we worked with our DTI team to just figure out who on our list have we missed. So this week's appointment, and last week too, we had opened up to those 3,000 persons or so that say, hey, we still want to be vaccinated. And so several of them should have been vaccinated last week, and some should be vaccinated this week. So we feel like we've gone through that list now. Those entries are coming every day. So as we receive them, we're going to continue to prioritize those that are 65 plus. Now, we also have lists of those that have completed online vaccine interest form, those that completed it from phase 1, phase 2, phase 3, and 4, and phase 5. On that list, our primary lens will be when it was completed. As we open up more appointments, we are going to pull names from that list as we receive them. But we're also looking at other measures of equity. Focusing on 65 plus is about equity, it's about vaccinating our most vulnerable population. And so we also still want to take into consideration demographics to ensure that there's balance in the distribution of the vaccine. We want to focus on our homeless population or those in congregate settings, as we have done. So as based on our understanding of the data, there are groups that we will pick from the data and prioritize at different times. But by and large, we will pull from that list based on when you complete the online survey. The good news is we've been working with Bill Nixon and our DTI team for several weeks to get a system, an appointment making booking system that we have better control over. And I think we should be getting very close and making announcement about that new system that allows us to have a better control. In the past, we open up the appointments, we attempt to prioritize groups, but the system we use really just could not do that. People, whoever is there, will just pick up the appointment. So this will give us better control where we can target groups. But by and large, still opening up to phase 5 is one thing. It means that everyone who is a Johnson County resident or work here who is 16 plus now qualifies. So now, do we have enough appointments for everyone? No, but do we have more vaccine in the county? Yes. Do we have more people giving out vaccine in the county? Yes. We have pharmacies. I spoke to two of our large pharmacies last week, Ivy and Walmart, and they're expanding distribution of the vaccines in their locations. Both of them are expanding to all of their locations in Johnson County. So that's there. I talked about doctors' offices receiving vaccine. Once we do that, those are additional avenues to get vaccine in the county. And our health systems are expanding. They're expanding where they're going to be giving out vaccines. They're expanding opportunity. I exchanged messages with two of them this morning. They were clarifying with me, is it time to start vaccinating people broadly? And the answer is yes. So the need for those categories is becoming less important. Right now, we are working on opening up appointments so that we can vaccinate people. If you want the vaccine, we want to give you the vaccine. So right now, we are going to place less emphasis on phase 1, 2, 3, 4, and 5. Rather, we want to create as many appointments as we can, as soon as we can, so you can get vaccinated.
Okay. Dr. Ariola, how many people in Johnson County have been vaccinated so far? And then do you know how many people we added by opening phase 5, how many more people that group is?
Yeah, that's a good question. So I would answer the question by saying that about 460,000 to 470,000 of our residents are 16 plus who will qualify for the vaccine. Okay. So thus far, the data that I showed last week showed that about 136,000 have received their first dose, but we feel pretty confident that that number is undercounted by quite a bit. So without trying to throw numbers there, that number, we have vaccinated more of our population than the 136 is showing. We get the updated number every Wednesday, and we'll provide that. It does not include those that are vaccinated outside of Kansas. So And you can so if you walk or live outside of the of the state of Kansas, and you are vaccinated and you live in Johnson County, that's not included in the counts that we have. And obviously by Wednesday you will have added a little bit more than 1 week of data. I also know that there are delay in data entry for us. Most of the time we run a day behind, but there are times when there's just so much data, or the move to the new location where we're still working out some kinks, where we are a few days behind. So those are not reflected in the data that we are given. So without a doubt, those numbers are easily 15, 20,000 more than what is currently shown. And so that's one thing to keep in mind. And so the estimate of how many people are in those phases, when we started phase 2, we had estimated up to 150,000 persons. And that was easy to do because we know we have slightly over 90,000 persons that are 65 plus, and about 20,000 persons K through 12 and childcare establishment, and then the rest, of course, in the groups, the different tiers that we had. And so the way to look at the data then is, if you are not in phase 1 or 2, then you are in 3, 4, or 5. And so assuming that 100% of our residents are going to take the vaccine, then we're still looking at probably close to 250,000 persons, or slightly more, that still needs to be vaccinated. My guess is that's the high limit. I don't think it's I don't think it would be that much higher than that if there are. But we also know that there are some of our residents that we are going to have to do a little bit more work to convince to take the vaccine. And so that's also things that you will factor in. And so if we're getting this level of vaccine, the amount of vaccine coming in from the state, and the pharmacists are getting the vaccines, and we're getting additional vaccines that we're sending to the doctor's office and vaccinating, you can see why in the next couple of months, we should have vaccinated a lot of our residents. And so, the hope is we're going to continue to get the vaccines and more. And I'm not discounting the logistics, because I think the logistics is very important that people don't see. So if this week, if we are giving out 10 or 15,000 first doses of Pfizer vaccine, it means that in 3 weeks' time, we're giving that exact number of second doses out. And so every first dose there is in addition to the 10 and 15,000. That's a lot of vaccinations to occur. So, so those are the things that I think it's important for people to understand. And even as large as we built our capacity, and if you look at the numbers across the region, across the state, it's pretty clear, even though we are a larger population, that we have vaccinated a lot of people and vaccinated very high percentage of our population, really comparing very well with others across the country. But it's a large county, and those logistics and your capacity, all of those have to be factored into how quickly you can vaccinate. But I can assure you that we work every minute of the day, every night, trying to figure out how to vaccinate more people. I was talking about next week. That's the goal. Next week, by the time we get into making the announcement, you are going to see that we are pushing and pushing and pushing, and just to make sure that we are opening up appointments for vaccination. Not only do we have second doses next week, Tuesday, Wednesday, Thursday, Friday, we're going to be adding really thousands of vaccination appointments for people to get their first doses next week.
So then how would you say your capacity to vaccinate is versus the number of people who are asking for it? Are those things lining up closer?
Yeah, it is. The demand is very high. And when we say we, I am looking at the county collectively and all of us, our health systems, all of our partners that are distributing vaccines. Thus far, we have been able to distribute all the vaccines that we have received every week. Okay, so we have successfully done that. So, but moving forward, when you are distributing 25,000 first doses, and 3 weeks after that, that number of doses are due for second dose, your capacity to give first dose will be impacted by that. And so as we move forward and we project forward, I do want those to be clear, that we will continue to ask our residents to be patient as we walk through this. We have staff that's been working on this for a year. We have volunteers that have been assisting. But again, our goals are not going to change. We're going to try to get the vaccine out as quickly as we receive them. And that's what we have done thus far. We are continuing to look for opportunities to expand and for partners to ensure that these are distributed, and we'll continue to do that.
I think you've touched on this a little bit, but when you look at how well Johnson County is doing, we fully vaccinated, I guess, according to the CDC, possibly almost 25% of our 18 plus population. I guess in general, why do you think Johnson County has been so successful?
Right. So our approach, and the numbers are close to being accurate. I think for us, we think it's slightly higher than that. But again, there's a lag between when it's reported and when the question is being asked. We also know that as of last week, I reported that slightly over 30% of our population that are eligible have received the first dose. That number has inched up more than that. I think our approach from the start was pretty clear, which was we are too large a county to depend on the 1, 2, or 3 clinics that the Department of Health and Environment is able to run. And so our plan from the start was to approach this from a local public health system, understanding the resources that the community trusts and the community are used to. And so those early partnerships with our health system has been very critical to where we are. It's been very, very important. I'll tell you the other thing. I just knowing what's going on in other places and other counties is that a lot of the counties now are really looking forward to doing the same thing and employing resources that the community trusts, because it is possible for you to open up the clinics and people don't show up, but it is easier for people to go to their doctors to get their shots. That's where they're used to getting their flu shots, and we are seeing that our uptake in Johnson County has remained consistently high. The problem for us is not that people don't want to take the vaccine, it's the availability of the vaccine. And so last week when we opened up the appointments, most were taken within 20 minutes, all were taken within an hour. And so talking to some of our health systems and just consistently exchanging ideas and being up to date, them expanding when they need to, us expanding when we need to. For a stretch, we did not have enough vaccine to go around. There was a stretch where we had to take vaccines away from what our health system expected because we just did not have enough. But that communication was very important, being on the same page. The only reason that happened was we wanted to really vaccinate deep in our 65 plus population. And that's turning out to be very helpful in our data. That's still the most vulnerable population. And that's part of why you see our death and hospitalization number down because we vaccinated that population. And so, so the approach, I think, it's worked very well. And one of the things that we've said to start with also is the beauty of the approach will be evident when we start getting more vaccine. And that's what you are seeing in the numbers. And so people should not just focus on the clinics that we're running, but look at the clinics that the entire system is running. And that capacity has been very impressive. Again, I've spoken with two of our health systems today. I know one is about to open another location in Johnson County to be able to vaccinate more people. And those are good things for the county. And exchange messages with them today is vaccinate anyone as long as they live or work here and they're 16 plus, everyone qualifies. Vaccinate, vaccinate, vaccinate.
Great. Thank you so much. That was some really good information about vaccines. A couple more questions, a little bit off subject. So this is These are questions regarding CDC's warning of a potential fourth wave due to more contagious variants, plus an uptick in travel with it being spring break. Several of our school districts in Johnson County have had their spring break already. So have you yet seen an uptick in cases? And if so, are you correlating that with spring break or travel or any concerns in that arena?
Well, yeah, excellent question. I think the first thing that I would say is uh, go to our website, take a look at our incidence rate and the positivity rate. You will see that the incidence rate has been flat for the past 1 week, and the positivity rate is actually starting to inch up. I think today it's up to 3%. We were down to 2.4, 2.5%. And so, yes, I share the same concern that the CDC director expressed today. It is possible to do the right thing and not do it at the appropriate pace or do it at the wrong time. I also drove around this weekend, and I know the good weather is very tempting, and people are out, which is a good thing. The weather is our friend. Being outdoor is our friend, but we have to do this um, better. We cannot afford to lose the gains that we have made. And so I believe that the flat lines that you're seeing is going to be the beginning of what would be some form of spike related to spring break and the travel. I do want to remind people that CDC has been pretty consistent that they advise against non-essential travel. And if you travel, if you have to, testing is very important. If you have been in a gathering of 500 or more persons, when you get back, get tested, isolate yourself. We cannot afford the virus to start spreading again. We've taken a lot of steps recently that collectively are going to impact our numbers. We have opened up our schools, which we wanted to do. Our priority has to be keeping our children in school. And to be able to do these things and begin to roll things back and allow visitors to our long-term care facilities, we have to keep the community spread low. And so spring breaks happen. We know that prom is on the way. We know that people are traveling, and the temptation not to wear masks and to not take those precautions remain very high. But we have to be careful. The CDC director said she is scared. I share the same concern. I am. That's one of the reasons why we are pretty happy, along with the local health officer, Dr. Limaster, that the Board of Health extended the mask mandate. We need that. We just have not vaccinated enough people to begin to do some of what we're doing. And yes, for us, it's not, for us, that concern remains there. We continue to hope for the best, to remain optimistic, but I could not spread this enough. Wear your mask, avoid large crowd. Outdoor is your friend. Spend more time with your family, but avoid um, spending time with too many people that are not in your bubble. Those concerns still remain very, very important. Otherwise, we're going to lose the gains that we have made. And for that trajectory to change to what's now been called the fourth bump. And by the way, it's not just here. We are seeing it happen in Europe. Italy is seeing a huge bump. And so with the variants taking hold in the country, we have to be careful.
Well, I think that is a great message to end on today, just reminding people about the importance of all those strategies that have been so important for over a year now. So um, anything to add before we wrap up for the day?
That's actually a very, very good way to end that. So keep doing what you're doing, our residents. We appreciate your cooperation. It is the actions that you have taken. That's why we are where we are. Let's keep the virus suppressed. Let's not lose the gains that we have made. And as we get more people vaccinated, we are going to have the opportunity to do all these things that we want to do. Thank you for your cooperation.
And thank you, Dr. Ariola, for sharing some very valuable information today. Thank you, Allison, for being our ASL interpreter. And thanks to those who are watching and staying engaged on this topic. Thanks so much and have a great rest of your day.